A new pathology. It has long been vaguely understood that the condition of a man's clothes has a certain effect upon the health of both body and mind. The well-known proverb, "clothes make the man," has its origins in a general recognition of the powerful influence of the hair. The same truth may be observed in the facts of everyday life. On the one hand, we remark the bold carriage and mental vigor of a man attired in a new suit of clothes. On the other, we note the melancholy features of him who is conscious of a posterior patch, or the haunted face of one suffering from internal loss of buttons. But while common observation thus gives us a certain familiarity with a few leading facts regarding the ailments and influences of clothes, no attempt has as yet been made to reduce our knowledge to a systematic form. At the same time, the writer feels that a valuable addition might be made to the science of medicine in this direction. The numerous diseases which are caused by this fatal influence should receive a scientific analysis, and their treatment be included among the principles of the healing art. The diseases of the clothes may roughly be divided into medical cases and surgical cases, while these again fall into classes according to the particular garment through which the sufferer is attacked. Medical cases. Probably no article of apparel is so liable to a disease condition as the trousers. It may be well, therefore, to treat first those maladies which they are subject. 1. Contradicto palentum, or shortening of the legs of the trouser, an extremely painful malady most frequently found in the growing youth. The first symptoms is the appearance of a yawning space, lacuna, above the boots, accompanied by an acute sense of humiliation and a morbid anticipatory of mockery. The application of treacle to the boots, although commonly recommended, may rightly be condemned as too drastic a remedy. The use of boots reaching to the knee, to be removed only at night, will afford immediate relief. In connection with contradicto is often found inflato genus, or bagging of the knees of the trouser, a disease whose symptoms are similar to those above. The patient shows an aversion to the standing posture, and in acute cases, if the patient be compelled to stand, the head is bent and the eyes fixed with painful rigidity upon the projecting blade formed at the knee of the trousers. In both of the above diseases, anything that can be done to free the mind of the patient from a morbid sense of his infirmity will do much to improve the general tone of the system. 3. Oases, or patches, are liable to break out anywhere on the trousers and range in degree of gravity from those of trifling nature to those of fatal character. The most distressing cases are those where the patches assume a different color from that of the trousers, dissimilatus coloris. In these instances, the mind of the patient is found to be in a sadly aberrated condition. A speedy improvement may, however, be effected by cheerful society, books, flowers, and above all, a complete change. 4. The overcoat is attached by no serious disorders except phosphorpheniasis, or glistening, a malady which indeed may often be observed to affect the whole system. It is caused by decay of tissues from old age and is generally aggravated by repeated brushing. A peculiar feature of the complaint is the lack of veracity on the part of the patient in reference to the cause of his uneasiness. Another invariable symptom is his aversion to outdoors exercise, under various pretexts, which it is the duty of his medical advisor firmly to combat. He will avoid even a gentle walk in the streets. 5. Of waistcoat science recognizes but one disease, porgrigia, an affliction caused by repeated spilling of porridge. It is generally harmless, chiefly owing to the mental indifference of the patient. It can be successfully treated by repeated fomentations of benzene. 6. Mortificato tilis, or greenness of the hat, is a disease often found in connection with phosphorencia, mentioned above, and characterized by the same aversion to outdoor life. 7. Sterilitias, or loss of fur, is another disease of the hat, especially prevalent in winter. It is not accurately known whether this is caused by a falling out of the fur or by a cessation of growth. In all diseases of the hat, the mind of the patient is greatly depressed, and his countenance stamped with the deepest gloom. He is particularly sensitive in regard to questions as to the previous history of the hat. Want of space precludes the mention of minor diseases such as 8. Odious socorum, or oddness of the socks, a thing that is itself trifling, but of an alarming nature if met in combination with contrario Pthlgy. Cases are found where the patient, possibly on the public platform or at a social gathering, is seized with a consciousness of the malady so suddenly as to render medical assistance futile. Surgical cases. It is impossible to mention more than a few of the most typical cases of diseases of this sort. Explosio, or loss of buttons, is the commonest malady demanding surgical treatment. It consists of a succession of minor fractures, possibly internal, which at first excite no alarm. A vague sense of uneasiness is presently felt, which often leads the patient to seek relief in the string habit, a habit which, if unduly indulged in, may assume the proportions of a ruling passion. The use of sealing wax, while admirable as a temporary remedy for explosio, should never be allowed to gain a permanent hold upon the system. There is no doubt that a persistent indulgence in the string habit or the consistent use of sealing wax will result in 2. Fractura spensorum, or snapping of the braces, which amounts to a general collapse of the system. The patient is usually seized with a severe attack of explosio, followed by a sudden sinking feeling and a sense of loss. A sound constitution may rally from the shock, but a system undermined by the string habit invariably succumbs. 3. Secura Pantalooni, or ripping of the trousers, is generally caused by sitting upon warm beeswax or leaning against a hook. In the case of the very young, it is not unfrequently accompanied by a distressing separation of the shirt. This, however, is not remarked in adults. The malady is rather mental than bodily, the mind of the patient being racked by a keen sense of indignity and a feeling of unworthiness. The only treatment is immediate isolation, with a careful stitching of the affected part. In conclusion, it may be stated that at the first symptom of disease, the patient should not hesitate to put himself in the hands of a professional tailor. In so brief a compass as the present article, the discussion has of necessity been rather suggestive than exhaustive. Much yet remains to be done, and the subject opens wide to the inquiring eye. The writer will, however, feel amply satisfied if this brief outline may help to direct the attention of medical men to what is as yet an unexplored field. That is the end of A New Pathology by Stephen Leacock.